Members of the U.S. Congress are close to passing a $17 billion plan to fix the problems at the Veterans Administration.
The full House and Senate still have to vote on this measure, but we're already seeing signs of both parties working together. This afternoon, senators approved former Procter & Gamble CEO Robert McDonald as the Veterans Affairs Secretary. He faces a big challenge, though, reforming an agency that has been plagued by long wait times and employees who falsified records to cover up delays. The $17 billion package will help hire more doctors and nurses. It also makes it easier to fire senior executives at the agency. Healthcare concerns have been evident even in Central Texas. Less than a year after opening a brand new facility in Austin, wait times remain high. We were there as veteran Gus Pena met with the woman in charge of the VA facilities in Central Texas. Pena tells us the clinic blames a backlog of patients needing help. But Pena says each day that goes by could be costly.
It's compromising their health, it's compromising their well-being, and we don't want any other veteran to die anymore. Enough veterans have died already without proper documentation and doctor's visits.
And he wasn't the only one voicing his displeasure today. Chris Sadeghi has more on how veterans are trying to get the medical attention they need. All new at 6.
Come on, Larry. This is what we've been waiting on. Signed a petition.
For weeks.
I'm still here and I got my water behind me.
Captain James Garrett has manned this corner.
Anything you need.
Letting everyone know.
That's what needs to be changed.
The protocol needs to be changed.
He's frustrated with this VA clinic.
This waiting time periods on claims, doctors, and everything else is for the birds.
By just standing outside the gate.
Let's put it to them.
He's making friends.
I like your tats.
People walk up.
PTSD, sleep apnea.
Cars stop by.
Treat veterans like we should be treated.
That's right.
Give us our appointments, give us our claims.
They add their name because they're just as tired as Captain Garrett.
Hours of waiting.
Hours of waiting.
They say the waits for appointments are too long and the medical treatment is not good enough. They hope their signature might help remedy the situation.
The more people, the more power we have.
With similar problems across the country, Congress appears ready to help.
Congress needs to step up and go ahead and pass this bill and put it and implement it.
Whether they do or do not, Captain Garrett plans on
bring Delgado to the table in the federal court
to demand the health care he and others need.
Semper Fi, brother.
And every name counts.
You'll be number 50.
In Southeast Austin.
You have a beautiful day, Mr. Jones, and thank you so much.
Chris Sadeghi, KXAN News.
And we tried to contact the director of Central Texas Healthcare Facilities of Veterans Affairs, but we're told she would not be able to comment about the complaints or the proposed deal in Congress. For some context now, the U.S. Department of Veterans Affairs says it had about 270,000 backlog claims. That was just as of Saturday. That's a big number, but despite a lot of attention, the backlog has actually been shrinking consistently. In March of 2013, there were 611,000 backlogged claims.